Hey, welcome everybody. This is the podcast series on innovative healthcare solutions. It's sponsored by the Conference of Consulting Actuaries with the CCA. If you've watched any of these before, and we've got quite a few of them that we've done already, these are really a series of interviews with professionals focused on delivering innovation in healthcare and really offer to provide insights about what's transpiring in the ever-changing landscape of the healthcare environment in which we live. My name's Ed Pudlowski. I'm president of Morningstar Actuarial Consulting, and I'm also chair of the healthcare community within the CCA, and I'm going to be your host for today's discussion. So I'm really excited today to be joined by Joe Connelly. Joe is CEO of Visana Health. Joe, thanks for joining us here today.
Thank you for having me, Ed.
All right. Joe, I'm going to throw a little twist at you here. Before we kind of jump into talking about Visana, you recently had ventured into a cross-country skiing race, right? So I want to, I'm curious before I start to know how you did.
I finished, which was my goal, and I beat some of my friends. So I improved a lot compared to last year, which is my first year doing it. And I didn't want to die on the course this year. So big improvement, and I met my goals.
That's always a given. Every time I go to the gym and I'm in the locker room afterwards, somebody asks me how I'm doing, and I said, I'm good. I'm able to walk out of here. I'm doing good, So
Exactly.
not dying on the course is a positive. Hey, Joe, Visana Health now, you're a virtual first full service women's health clinic. Give me a little idea of like what gap did you see that existed in the healthcare marketplace that, it made you kind of think about creating this opportunity for Visana Health?
Yeah, absolutely. So this company, Visana, actually was born out of some family members' experience with really complex and chronic gynecological conditions, including my mom, my aunt, my grandma. And I think really exemplified to me that women's health is so much more than maternity and fertility, which is the way that the market has traditionally viewed women's health. So to give you a flavor of some of the problems we're trying to solve, my mom had such severe pain during her period that she would often be vomiting for 3-4 days out of every single month. And despite that level of pain, when she would go seek care from doctors, she was basically dismissed and told that she should just take some ibuprofen and tough it out because periods are painful. She never got any type of care at all for 25 years. So it took her 25 years just to even get to a diagnosis.
Wow.
And the first treatment that was offered to her was a hysterectomy, so a surgery. And it turned out she had endometriosis, she had fibroids, she had a variety of gynecological pathologies, which can be treated in much more conservative modalities if you read ACOG's guidelines. And so Visana got its roots in those high cost and complex gynecological conditions where we can not only drive a large step function and improvements in outcomes, but also try to reduce the total cost of care for health plans and self-funded employers. From there, we have really expanded very rapidly because women's health is this very broad subject. So again, traditionally viewed as maternity and fertility, but there are a whole slew of conditions that uniquely, differently, or disproportionately impact women. So for instance, autoimmune, the prevalence is 80% women. Migraine, the prevalence is 80% women. Women encounter cardiovascular disease much differently than men do and at different ages. And so when you think about the healthcare system at large, it's really built around men without thinking about all of those different gynecological or other conditions like I just described.
So give us a flavor of how Visana works. So you're a virtual platform. So maybe kind of take us through the journey, like an example of how somebody, would get connected with you and utilize your services.
Yeah, so we work B2B. So we work with self-funded employers and health plans to reach out to members who might benefit from our services and raise awareness about those services. We are a medical group, so we're typically a network provider, and we oftentimes have a benefit configured around us. And so from there, all of our members start with a very extensive and detailed intake where we are really taking care of that whole woman. So if she comes in with signs and symptoms of endometriosis, we're also screening for and creating a care plan for GI symptoms, pelvic floor MSK symptoms, behavioral health symptoms, and really creating a whole person and evidence-based care plan. We do practice medicine in all 50 states, and we have an in-house medical group consisting of OBGYNs and women's health nurse practitioners. And we have extremely tight quality controls to make sure that we are delivering world-class healthcare for every single woman that comes through our door. And we see people that have UTIs and need birth control refills, so relatively low acuity, all the way up to people that have 15 different comorbidities and have many different issues going on. And so we really make sure that they have a longitudinal experience where they're seeing the same Visana clinician every single time. And we're employing evidence-based medicine that takes care of that whole human being to make sure that we can reduce the total cost of care.
So you're a B2B platform. How do you integrate with the underlying health plan? Like, are your services paid by the plan, or are they kind of carved out as kind of a separate entity?
We are typically paid for within the plan. So we submit claims, we hit the medical loss ratio. And so we make sure that we play within the existing framework of the health plan instead of trying to carve out completely.
Oh, great. That makes things a lot easier then, doesn't it?
Always, yes.
So your website is full of a lot of statistics. If I remember this correctly, like 88% report improvement in their mental health status, 71% reduction in emergency room visits, 76% reduction in unnecessary surgeries, 69% reported improvement in access to care, which I you would expect in a virtual model, but that's still pretty high number. Can you maybe give some more insights into behind these numbers, and maybe even talk a little bit about how you develop these and arrived at those, just to give our audience a little bit understanding of kind of the detail behind those results.
Yeah, absolutely. We're a very outcomes driven company. So we are trying to deliver world-class women's healthcare that not only delivers a step function in those clinical outcomes and access metrics that you mentioned, but also making sure that we're reducing the total cost of care. And so we work very closely to identify what the highest cost and most complex conditions are, where we can really achieve that triple aim goal, and then make sure that we have a care model specifically built to be able to achieve those metrics. And so the way that we really think about that, we've actually done a very large claims analysis where we've looked at all of the different total cost of care drivers and all the different conditions that overlap. And we studied what makes women different than men clinically, and what makes women different than men actuarially. And then we started to quantify where we were seeing the highest costs that were extremely prevalent and had the opportunity to be reduced through better care. So really creating a value-based care model. And so that's where we got our foundation, is making sure that we had a really strong underpinning with that data. And then we went out into the real world and started to actually validate all of those different metrics. So from the very first day that we were founded about 5 years ago, we have measured outcomes for every single patient that comes through our door. I think that there are very few healthcare providers that are measuring and monitoring patients to the level and degree that we do. And we look at metrics all the way upstream, all the way through to total cost of care, because there's different leading indicators to say, how do we make sure that we're achieving the best clinical outcomes? How do we make sure that we're optimizing time to that clinical outcome? How does that look different across all of our patient populations? And then how do we look at some of our referral data even to make sure that we can ultimately deliver that impact of better outcomes at a reduced total cost of care? And so we hold ourselves to very high standards across the entire patient journey, and we monitor and measure those outcomes for every single patient that comes through our door. And we have systems that flag when outcomes aren't going well with patients to make sure that we have a very high touch model and that we get that patient that might be struggling with a clinical outcome to actually feel better. And ultimately, what that led to is we actually had a case match control claims analysis that a health plan's actuaries ran on a Visana cohort versus a case matched non-Visana cohort that demonstrated about a $2,500 reduction in the total cost of care. And so we really think about it in terms of condition-specific journeys, knowing what the status quo is today, knowing what our service design should be, and then quantifying that across that entire spectrum, knowing that these total cost studies take multiple years to be able to get done.
Yeah. So let's talk little bit about maybe what information you collect. So obviously you talked about integrating with the health plan, and you were able to do this study through the use of actuaries, which I'm sure many of our audience would appreciate hearing that. But talk a little bit maybe about what data you have in-house and how you were able to integrate that with the health plan data, because I'm assuming you don't have 100% engagement with all the women in the health plan that you have. Maybe you do. I don't know. I haven't seen anybody with 100% yet. But maybe you can talk a little bit about how you kind of modeled that against the population you have with the data you have against the cohort of folks that you didn't have an engagement with.
Yeah, absolutely. So obviously, one of the limitations of claims data from the health plan side of things is it's not rich clinical data. So you may know that a patient has a certain condition, but you don't know the severity of that condition. For us, it's you don't know what pain scores they have. You don't know what GI symptoms they have. Sometimes they may be miscoded for their MSK issues or miscoded for their behavioral health issues. And so particularly in women's health, where there's a lot of misdiagnosis or undiagnosed patients, relying on claims data can be very, very, very difficult to do. And so we have a treatment relationship with these patients. We become the OBGYN of record, if you will, for many of these patients. And because we are treating these patients, we often have access to their medical records. And so we are collecting very rich, structured clinical data through very extensive assessments, that 1 hour intake that I mentioned, to make sure that we are collecting a whole slew of data that not only relies specifically on our gynecologic condition, but is also looking at those over other comorbidities that she may have. So we have anxiety and depression scores for all of our patients, and we monitor those over time. We're able to access lab data, imaging data, their prescription data, other information from the HIE to make sure that we can actually have that full clinical picture that includes not only some of the claims that we're billing for, but also, the information that's really needed to be able to improve those outcomes.
So maybe talk a little bit then about your staff and your providers that are having interaction with the individuals in the health plan.
Yeah, absolutely. So we staff OBGYNs, women's health nurse practitioners, coaches, and care coordinators. And again, these are all in-house. All of our providers work a minimum of 20 hours a week for Visana. We recruit and train them all, and they go through very extensive and rigorous quality monitoring. And so these people are people that specifically are looking to practice medicine in a different way. So we are actually giving our providers the time and space to be able to take care of that whole person through our value-based care model. And what we've heard a lot from our doctors is that they say, if I work in this fee-for-service health system, I'm pushed to churn patients every 6 to 12 minutes. And I just don't have the time or the energy to be able to really take care of these more complex patients that have multiple different issues, which is the bread and butter of what we're doing at Visana. And so the people that are self-selecting into our clinical care model are ones that are wanting to be challenged with difficult and complex patients. They're really interested in making a difference and improving the clinical outcomes. And ultimately, what they tell us is this is the reason that I went to medical school. I went to medical school to help individuals and improve their outcomes and not feel like a cog in the wheel. And so with that space and the clinical model that we've really developed, they're able to build that personal one-to-one relationship with that individual and making sure that they can provide that high-touch care when it's clinically appropriate. Our chief medical officer is absolutely phenomenal. Her name's Dr. Barbara Levy. She actually sits on the CPT editorial committee, so she knows claims data backwards and forwards. And she was the vice chair of health policy of the American College of OBGYN for many years and practiced clinical medicine for 40 years. And what we've built is almost a technology layer that allows us to do that ongoing quality monitoring for all of our patients because it's sitting on that structured data so that we can make sure that we are delivering consistently high quality care to every member that comes through our door in a way that's really empathetic and a way that really makes women feel heard. I kicked off part of this by saying that my mom was basically told to take some ibuprofen and tough it out because periods are painful. That very sadly is the status quo for many women that are seeking healthcare today. They don't feel heard in the healthcare system and they feel very dismissed. And our care model really gives them this opportunity to tell their story and feel heard.
Yeah, so you're giving them much greater access to the providers that you have, just in terms of the amount of time that they integrate with. But I'm assuming that because this is a virtual platform, that you're also able to get into underserved communities as well.
100%. That's right. And I think what we found is a lot of women that do have gaps in care. So they're not up to date with their mammograms, their cervical cancer screenings, so on and so forth. A lot of them just can't access healthcare to begin with. A lot of OBGYNs now have 6, 9, 12-month long wait lists. And if all you need is a pap smear, you're going to be deterred by that. And so our ability to have appointments within oftentimes just a week, sometimes same day appointments, really allows women to increase access to that consistently high quality care as well, in a way that they're not able to get in a brick and mortar environment. And I would say that's consistent, rural, urban, and even those that are under-resourced, if you will. And so I think obviously then that power of virtual care is amplified when you are in a rural environment. And we have a very strong dedication to health equity. I think in the women's health space, particularly, there are huge health equity gaps that we can really address through virtual care, and by making sure that we are stratifying our patients and looking at our outcomes and making sure that we are delivering just as good an outcomes across every aspect of diversity, and then also making sure that our patient panel looks like the members that we are serving. And so we're very thoughtful around the providers that we recruit to make sure that we're hitting in our internal diversity goals, which then help us deliver consistently good outcomes across race, gender, sex, and so on and so forth.
Those are fantastic results, and I really give you guys a lot of credit for everything you're doing in this space. Joe, is there any question that I didn't ask that I should have?
I don't think so. This has been a very comprehensive discussion, Ed, and I really appreciate it.
Oh, great. Well, hey, Joe, really appreciate your time today. I'd like to encourage all of our viewers to participate in our healthcare community within the CCA. You know, we can try to continue some of these discussions about some of the insights that were shared here, and do so on that platform. Now, if you're not a member of the Conference of Consulting Actuaries, you might want to consider joining, not only for the experience that I just mentioned about our healthcare community platforms, but a lot of the other great benefits that our members enjoy. Joe, hey, really, thanks a lot for being here today and sharing your insights about Visana Health and what you're doing to really drive innovation in healthcare. I think there's a lot of great results. Really respect the fact that you are a data-driven organization, and you've gone through to try to prove your value proposition already. So there are many in this industry, I think, who kind of forego that step. So really appreciate that, hearing that. I know, hey, I really benefited from our discussion today, and I'm sure our audience did as well. And again, really appreciate your time today.
Yep. Thank you for having me, Ed.